all. Welcome back to LoveRose Talks. We again are introducing Isabel White, who is a cancer care nurse and a sexual therapist. So this is our third of these videos. So if you haven't seen 1 and 2, go back onto our YouTube or Instagram and check them out. So in our last video, we were talking about practical advice for sexual arousal issues and low kind of sexual desire after a breast cancer diagnosis. And so today, Isabel, if you could just discuss with us the kind of issues around sexual pain after that diagnosis.
Absolutely, Sarah. I think for me, probably the first place to start is to think about some of the physical practical tips that can be really useful, because quite often we attempt to be intimate without realizing that actually we've had changes in our vaginal health, and perhaps we haven't implemented any tips or strategies that might help with that. So I always go for those things first. Particularly where you're experiencing vaginal dryness and perhaps the vaginal lining being quite fragile and thinned, as often happens when you're on endocrine treatment for your breast cancer, but also happens after chemotherapy at times as well, is to think about things that will actually reduce the pain triggers and reduce the amount of friction that might be likely during penetrative sexual activities. So I would start off by thinking about vaginal moisturizers. Now, a lot of women are very keen to make sure they moisturize their faces and look after the skin there, but they don't necessarily think that it's useful or helpful to moisturize the vagina and the vulva, but it can be very useful, particularly when our body's not making the same amount of natural lubrication generally because of the treatment that we've been receiving. So vaginal moisturizers are non-hormonal, so they're completely safe for women with estrogen receptor positive breast cancer to use. They are used on a regular basis, not on an on-demand basis. What I mean by that is that they're used during the week, 2 or 3 times a week, whether or not the woman is going to be sexually active that week or anticipates that being the case. There are lots of different vaginal moisturizers on the market. They can be obtained over the counter, and they can also be obtained from your GP on prescription, and they are used to help improve the moisture content and the comfort of the vagina and the vulva, which can reduce sensations of dryness and itching. And then in conjunction with that, in addition to that, I would say it's good to use an intimate lubricant for sex itself, or indeed for using a sex toy if one was using a sex toy. So I would say we should be looking at intimate lubricants, and these can either be water-based, oil-based, or silicone-based. Then there are things like sexual positions advice. Women may find that they prefer to go on top of their male partner because that helps them control the depth and the rate of penetration, as well as the angle of penetration when they're having penetrative sex. So they may find that more confidence building, if you like, than lying underneath their partner. Or they may find that they prefer to lie on their side with their partner behind them and actually entering their vagina from behind, which again limits the amount of depth of penetration that's possible. For other women, they might want to use a device to actually reduce the depth of penetration if deep penetration is uncomfortable. And on the slides that you've put on the LoveRose Talks website, there's a new product, or relatively new product on there called the O-Nut, which is like a little donut that actually goes over the male partner's penis and reduces the depth to which the penis can be inserted into the vagina, which can be, again, really helpful at helping women gain confidence in penetrative sex, because they know that their partner, and particularly if their partner's quite well endowed, isn't going to actually penetrate too deeply and cause them discomfort. Sometimes it's helpful to do what we call self-graduated exposure to sensation and touch, because it may be that you've not had sex, particularly penetrative sex, for quite a long time if you've gone through a long period of treatment. So sometimes just being able to touch yourself, maybe insert your own lubricated fingers gently into your vagina to see what it feels like, or indeed for your partner to do that with their lubricated fingers, just gently exploring what it feels like. Some women will use a vibrator to gain that experience, or they might use a dilator just to help open up the vagina a little bit. But all of that is to help you get used to feeling something inside again and actually help you relax under those circumstances, rather than doing what we tend to do, which is when it feels different or unusual, that we tense the entrance to our vagina, thus making it even tighter. And of course, that's more likely to increase pain. Kegel exercises, or what we call pelvic floor exercises, can help us improve awareness of when we're tense and have contracted our pelvic floor and made it really tight in the entrance of the vagina, and when we're actually properly relaxed to allow penetration more readily. And again, you can find information about pelvic floor exercises on the internet. And then last, but by no means least, a technique that we call sensate focus, but really it's about breaking sex down into smaller, manageable steps, beginning with things that don't involve penetration and gradually building up over time to more penetrative aspects of sex, which helps us encourage arousal and relaxation rather than fear of sexual pain, which often can make us feel tense and unable to feel aroused. But again, that sort of information can be found on the website and through a variety of books and channels that way.
Thanks so much. That's a great overview. And yeah, as we said, everything that you've mentioned will be on our website in LoveRose Talks. And so everything you've kind of directed and signposted to. And tune into our next video where we'll go more into where people can go for information and support.